This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
Good morning, everyone. So I'm first off going to say I'm sorry if any of you guys have heard this one already. We're going to do a medical minute about dental infections. I didn't record the last one, and we see a lot of them here. I feel like the last couple of EDs I've worked in, I have not seen as much dental pathology as I see here. I see quite a bit. So I had a case yesterday, so we're just going to review a couple of things. So I like to divide dental infections into two main groups. The first one is dental infections that come from the gums, so things or dental issues that come from the gums, and then dental issues that come from the teeth themselves. And the reason I think that those two things are helpful is because it helps you sort of think about what you have to worry about in terms of the end game pathology. So when we talk about issues that happen with the gums, the first thing we think about is pericoronitis, which is kind of that feeling of like a tooth erupting, some gingival irritation. A lot of times it doesn't involve infection, and it typically doesn't require any additional treatments or antibiotics, just kind of some pain control. You can end up with full-blown gingivitis, and depending on the kind of severity of that pathology, you may reach for some antibiotics to help the patients with that specifically. And then if you let it go to sort of its end pathology, you can end up with a condition called ANUG, or some people call it trench mouth, which is a horrible thing to think about. But it's basically this filmy, grayish discoloration of the gingiva, kind of leading up to the teeth. The teeth can be loose. It can be very painful. The teeth themselves don't tend to cause a lot of sensitivity, but it can be very painful. And a lot of times patients will lose, a large majority of their teeth just because they are so loose. The infection does require antibiotics. Oftentimes those patients can be treated with IV antibiotics and may even require admission. So it can be pretty severe. Somewhere kind of between gingivitis and having a full-blown ANUG infection, you may end up with sort of an abscess that's sort of just right next to the tooth. That can happen. Those sometimes need to be drained. But I want to separate that from the next kind of list of pathologies that I'm going to talk about, which starts with dental caries or, a cavity. So things that come from the tooth themselves, you can have some of these erosions, and they can cause tooth sensitivity as they start to get through the enamel. You can end up with an actually infected tooth, and that can cause a lot of severe, pain and discomfort. Oftentimes this is when we're taking something hard like a tongue depressor, we're actually tapping on the teeth. And if we find that to be sensitive, oftentimes we're worried they at least have an infection, maybe something that has infected the root of the tooth. And then we're starting to look for additional pathologies. When we see these patients who come in with these big swollen faces and have, a single tooth or maybe a couple of teeth that are sensitive, these are periapical abscesses. And these are abscesses that basically go all the way down through the root of the tooth, and then the infection pops up somewhere else. And that somewhere else can kind of vary. It can be something that's kind of right next to the tooth, will cause tooth sensitivity. That's how you kind of differentiate it from just an abscess that's close to the tooth involving the gingiva. But you can end up with these that are pretty close to the tooth. You can also end up with them in a very wide variety of other places. So you can end up with them in the buccal mucosa. You can end up with them underneath the tongue. And sort of the end pathology for patients who have really bad periapical abscesses is something called a Ludwig's infection, which is what this person presented with yesterday. And so it's an infection that kind of settles underneath the tongue, and the reason that we worry about it so much is because as that expands, you're obviously compromising the patient's airway. And so those people need kind of aggressive antibiotic management and oftentimes some sort of debridement. Good antibiotics to use for mouth stuff. Clinda is pretty good. Augmentin is pretty good. I've seen a lot of patients now coming in on amoxicillin, which a lot of dentists are reaching for. But if they end up needing something additional, oftentimes I will just upgrade that to an Augmentin. And then there's a solution called Peridex that is helpful just for a lot of gingival irritation. All right, let's have a good shift.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.